What's up, everybody, and welcome to the Health Policy Insight Podcast, Episode 5. We may have fought our way through the OEP finish line, but we're still flying forward full force. We're flipping the format and fully focusing on a fantastic, federally facilitated frenzy of fresh facts. That's right, it's all marketplace all the time. No mundane Medicare detours, just a forward-flying freight train funneling the freshest FFM facts your way. So fasten those formularies, folks, because we'll be flying through this faster than a floor walker with FMLA fleeing their final flag on a Friday.
When policy engine ends agenda, you need the latest intel, and you need it swift. From Medicare plans to marketplace trends, we're making sense of the changes ahead. Regulations and innovations, breaking down the threads you need to thread. We decode the maze of healthcare ways, so you can navigate through brighter days. Health policy insight, making complex clear and bright.
Welcome to the Deep Dive. Today we are going to take a deep dive into the Affordable Care Act in 2025. Basically, think of this as like your shortcut to understanding what's actually going on with the ACA right now. We've got all sorts of stuff here. We've got articles and research and data, and we're just going to pull out the most interesting pieces of information for you guys.
Yeah, it's a pretty interesting time to be talking about the ACA. Because, you have record enrollment numbers, but there's also some issues that are kind of bubbling beneath the surface. So, it's kind of like you bought a shiny new car and you're driving it around, but you can kind of hear like a weird noise in the engine.
Okay, yeah, that's a good analogy.
Yeah.
So let's start with the good news first. ACA enrollment is booming right now. Almost 24 million people are signed up, and that's more than ever before. Mm-hmm. So how did we get here?
Well, a big part of it is the enhanced subsidies that came with the American Rescue Plan Act, or ARPA, and the Inflation Reduction Act, or IRA. So those laws, they were passed a couple years ago, and they basically made health insurance a lot more affordable for a ton of people. It's all based on your income and the federal poverty level, or FPL. And with these new laws, more people are able to get subsidies, and the amount of the subsidies is also bigger than it used to be.
So, for example, if somebody's income is below 150% of the federal poverty level,
right,
then they can get a benchmark silver plan for free.
Exactly. And they also got rid of the cap on who can get subsidies. So, before, if you made more than 400% of the federal poverty level, you just couldn't get any subsidies at all. But now, even if you make more than that, you might still be able to get some help. So that's been a huge deal for a lot of people.
Yeah, it definitely sounds like it. And another thing that's interesting is this whole passive re-enrollment thing. Apparently, more than half of the people who re-enrolled in the federal marketplace in 2025, they did it automatically. And that's double the rate from last year.
Yeah, it's pretty interesting how many people are just letting their plans roll over. I guess they're happy with their plans and they like the price, so they're just not bothering to shop around. But what's interesting about that? Even though it's great for boosting enrollment numbers, there might be a downside to it.
Oh, is this where the engine problems start to come in?
Yeah, you could say that. The thing about auto re-enrollment is that it can actually make it easier for fraud to happen.
Wait, really? How does that work?
Well, let's say somebody snuck into the ACA and enrolled fraudulently. Maybe they lied about how much money they make so they could get more subsidies. Well, with automatic re-enrollment, they'll just keep getting coverage even if they don't even know it. And the system might not even catch them.
Oh, wow. That's kind of scary. And I also read that sometimes insurance companies aren't even telling people that they're covered.
Yeah.
Especially if they're on these $0 plans where they don't have to pay any premiums.
Yeah, that's right. And even when people do get renewal letters, a lot of times they don't have all the details. They won't say how much the premiums are or how much they're getting in subsidies. So people can get really confused and not even realize they're enrolled in a plan. Or they might not realize that their coverage has changed.
So you have all these people who are getting re-enrolled without even knowing about it. Yeah. And then you have this possibility of fraud on top of that. Yeah. It just sounds like a recipe for disaster.
Yeah, it definitely raises some concerns. And, while we're on the subject of shady practices, we got to talk about what's been going on with some of the brokers and agents who help people sign up for ACA plans.
Oh, yeah, I read about that. Something about how they get commissioned. So it sounds like there's a lot of incentive for them to to kind of bend the rules a little bit.
It was more than just bending the rules, unfortunately. Before July of 2024, some brokers were basically taking advantage of the system to make more money. They were switching people's plans without even asking them, just so they could get the commission for that new enrollment.
So they were just like moving people around like chess pieces or something just to make a buck?
Yeah, basically. And it was happening a lot. And it was making the active enrollment numbers look way higher than they really were. But the good news is that CMS, that's the Centers for Medicare and Medicaid Services, they cracked down on all these unauthorized commission changes.
So what happened after they did that?
Well, all of a sudden, there were way fewer of these shady plan switches. Like CMS said that commission changes went down by 90% after the new rules went into effect.
Wow, 90%, it's huge. But didn't that also mean that active enrollments went down too?
Yeah, they did. But that's actually a good thing, because those active enrollments were mostly just fake. They were happening because brokers were switching people's plans without their permission. And even though active enrollments are down, overall enrollment is still really strong. And that's partly because of all those passive re-enrollments we were talking about before.
Okay, so it sounds like CMS was able to plug a pretty big hole in the system. But this whole situation just makes you wonder about the incentives that are built into the ACA. Because it's not just brokers who might be tempted to game the system, right?
Exactly. Insurance companies also have a reason to want as many people enrolled as possible, even if those people aren't really qualified.
How come?
Well, brokers and insurance companies both get paid every month for each person who's enrolled in a plan. So there's a financial incentive for them to encourage people to sign up, even if it means pushing them to lie about how much money they make so they can get subsidies they're not supposed to get.
So you have this situation where you have auto re-enrollment, which can let fraud slip through the cracks. And then you have brokers and insurance companies who are basically rewarded for enrolling as many people as possible, whether those people are eligible or not. It just seems like there's a lot of potential for things to go wrong.
It's a valid concern. And this actually brings us to another point, which is that even with all the good that the ACA has done, there are still millions of Americans who are falling through the cracks.
You're talking about those 16 million workers who are still uninsured, right?
Yeah.
And over 10 million of them have full-time jobs. It's just crazy to me that in 2025, we still have so many people who work full-time and still can't afford health insurance.
Yeah, it's a complicated issue. And it's important to remember that when the Census Bureau talks about people being uninsured, they mean that those people didn't have health insurance for the entire year. So the actual number of people who were uninsured at some point during the year is probably even higher.
So you're saying there are people out there who work full-time, they get a paycheck every week,
Yeah.
and they still can't afford to have health insurance.
Yeah, that's the reality for a lot of people. And if you look at the data, you can see some pretty troubling patterns. For example, Hispanic workers have the highest uninsured rate at over 21%, and Black workers are over 9%. And that's compared to just over 5% for both white and Asian workers. So clearly, race and ethnicity are playing a big role in who has access to affordable health insurance.
And it's not just race and ethnicity.
Yeah.
There are also differences based on gender and age and whether or not you're married and whether or not you have kids and your education level and how much money you make and whether you're a citizen. It just seems like every factor you can think of is contributing to this problem.
Yeah, it's a really complex web of factors.
Yeah.
And it just shows that even though the ACA has made a lot of progress in helping people get coverage, we still have a long way to go before everyone can afford to see a doctor when they need to.
Yeah, for sure. And to make matters even more difficult, the ACA itself is facing some pretty strong headwinds, both legally and politically.
You're absolutely right. One example of that is the whole legal battle over whether DACA recipients can get coverage through the ACA.
Oh yeah, that's been like a total roller coaster ride.
It really has. So first there was this rule change that said DACA recipients could enroll in the ACA. But then 19 states sued to stop that from happening.
Yeah.
And a federal judge put a temporary hold on the rule, so DACA recipients couldn't enroll. But then that hold was lifted, and DACA recipients were able to sign up for coverage, but only for a little while.
Yeah, then the injunction was put back in place, right?
Yeah.
So now DACA recipients in those 19 states are basically back where they started.
Yeah, unfortunately. And the worst part is that all the people who did manage to enroll during that short period of time, they're now having their 2025 policies canceled, and they're getting their premiums refunded. So it's just a really messy and stressful situation for everyone involved.
And on top of all that, the enhanced ACA subsidies that we've been talking about.
Yeah.
You know, the ones that have helped so many people get coverage and afford their premiums. Well, those are set to expire in 2026.
Exactly. And if Congress doesn't do anything to extend them, millions of people could lose their coverage, and premiums could go way up.
So basically, the ACA is facing like a double whammy. On the one hand, you have these legal challenges that could make it harder for people to qualify for coverage. And on the other hand, you have this political uncertainty that could make coverage way too expensive for a lot of people.
It's a really precarious situation, and it's making a lot of people worried about the future of the ACA and the future of healthcare in America in general.
Yeah, no kidding. And speaking of politics, it's no secret that the ACA is a really divisive issue. Democrats are generally in favor of it, and Republicans tend to be against it. But even within those two groups, there are some interesting things happening.
Yeah, like for example, some Republicans are starting to say that they support extending those enhanced ACA subsidies.
Really? What's going on there?
Well, it seems like they're worried about what might happen if those subsidies expire. They know that millions of people could lose their coverage, and that could have a big impact on their voters, especially the ones who don't make a lot of money.
So it sounds like maybe some Republicans are realizing that they need to be more practical about this, instead of just sticking to their ideology.
Maybe so. And it could be a sign that the ACA is becoming more accepted, even among people who were against it before.
That's an interesting development for sure. But even if those subsidies do get extended, the ACA still has an uphill battle ahead of it. And one of the problems it's facing is actually connected to that big data breach that happened back in 2023. You remember the Move It data breach?
Yeah, that was a big one. A lot of organizations were affected by that, including Maximus Health Services, which plays a big role in administering the ACA.
Right, and now Maximus is being sued in a class action lawsuit because of that breach. And they tried to get the case dismissed. But a federal judge in Massachusetts said no.
That's a pretty big deal, because it means that the judge thinks there's enough evidence to show that people who were affected by the breach were actually harmed.
Right, and the breach exposed millions of records. And some of that data was even posted on the dark web. So there's a real chance that some sensitive information held by Maximus was compromised.
Yeah, it's definitely a worrying thought, and this whole case just shows how important data security is, especially when you're dealing with sensitive information like health records.
It's a stark reminder that even with all the good that the ACA has done, it's still a system that can be taken advantage of, both by people on the inside and by threats from the outside.
Absolutely. It's a complicated situation, and it just shows how hard it is to balance making healthcare accessible to everyone, while also keeping everyone's information safe.
Well said. So on that note, let's shift gears a little bit and talk about something more positive. Let's talk about some of the things that are happening that could actually make the ACA stronger and improve the lives of millions of Americans.
It's definitely good to focus on some of the positive things that are happening.
Speaking of positive changes, public support for the ACA has been going up lately. It's actually at the same level it was during Trump's first term.
That's pretty interesting. More and more Americans are starting to think that the government should make sure everyone has health insurance. It's up to 62% now, and that includes Republicans too.
So why do you think that is? Do you think it's just because people have gotten used to the ACA being around?
I think it's more than just that. The ACA has really made a difference in terms of reducing the number of uninsured people in this country. Back in 2009, over 16% of Americans didn't have health insurance. And by 2023, that number had dropped to 8%. That's a huge improvement. And it's all thanks to the ACA.
So it sounds like people are starting to see the real-world benefits of the ACA. They're realizing that it's actually working, and it's helping them and their families and their communities. And that's why they're starting to support it more, even if they were against it at first.
Right. And this growing support could be really important for the ACA's future, especially since it's still facing those legal challenges and political uncertainty that we talked about.
Yeah, for sure. It seems like the ACA is slowly becoming a normal part of American society. It's not seen as this radical new thing anymore. It's just part of the safety net, like Medicare and Medicaid and Social Security.
It's pretty remarkable when you think about it, especially considering how much opposition there was to the ACA at first. It just shows that even when things are really politically divided, we can still make progress on important issues that affect everyone.
It's a good reminder that if you keep fighting for something you believe in, you can eventually make a difference.
Absolutely. But it's also important to remember that the ACA isn't perfect. Like we said before, there are still millions of people who don't have insurance, and there are concerns about fraud and whether the program can stay afloat in the long run.
Right. It's like we built this amazing machine, but we haven't quite figured out how to make all the parts work together perfectly yet.
Yeah, that's a good way to put it. And if we don't fix those problems, they could get a lot worse.
So what about the ACA itself? Do you think it's going to survive?
It's hard to say for sure. It really depends on what happens with politics. But the good news is that more and more people are supporting the ACA now. And it's become a really important part of the healthcare system for a lot of people.
So you think it's going to stick around?
I think it probably will. It might change a bit here and there,
Mm.
but I don't think it's going away anytime soon.
Okay, so before we wrap things up, what are some of the key takeaways you want our listeners to remember?
Well, first, I think it's important to understand that the ACA is complicated. It's done a lot of good, but it also has some problems.
Right.
And second, the future of the ACA is uncertain. It could go in a lot of different directions.
Okay, so what's the bottom line?
The bottom line is that healthcare is a human right, and we need to keep working to create a system that works for everyone.
Absolutely. So I guess the question for our listeners is, what do you want the future of healthcare to look like?
Yeah, think about that. Because ultimately, it's up to all of us to shape the future of healthcare in America.
Well said. That's all the time we have for today. Thanks for joining us for this deep dive into the Affordable Care Act. We'll see you next time.